reported, abuse has not gone on. But we will be extremely glad that we have a unique situation compared to what is going on in the world, that in this crisis period, the cases of prevalence of domestic violence have gone down. Again, you can only deal with what the statistics says. You cannot cook or you cannot insist that contrary to the statistics, something else is happening. But as practitioners and as activists, we are seeing a lot of things happening. Child abuse, child sexual abuse in general, all forms of attack and assault is going up around us. And we would like to interrogate the statistics and do other surveys to understand what else is happening with people's lives.
Okay. So it is possible that people may not have come forward to reports because of their peculiar situation. So people haven't reported doesn't mean abuses are not going on.
You know, I always say that even in normal times, people don't report cases. So it is not like in normal times, everybody who has been abused within the domestic setting was coming over to the police or came over to the police to report. No, even in normal times. So therefore, we are unable to really use that argument solely to explain that we recorded low cases because of the lockdown and people were unable to come. Okay, the second point also is that assuming that that is what the case is, like people couldn't come because of the restrictions. After the restrictions, we could have an inflow of reported cases. Okay. Then we would have seen a high increase of reported cases, but that's not the issue.
But also using the comment by Diana, so this argument that the person who is abusing is monitoring my movements because
so that's what I'm saying.
They're idle now.
That's what I'm saying, that now, in normal times, now almost everybody is going back to work, technically speaking. There are still people I know who are still working from home. Now, it depends on what you are doing. So assuming you are in an abusive relationship and you sell at the market, or you are a nurse, you are a doctor, you are a teacher, because abuse has no respect for society. Exactly. So if you were going to work, yes, people can monitor, people can follow you, but you see, the good thing is that assuming I'm being abused at home, I mean, if you invited me here, I can tell you that, Mama, please, this is my problem. Can you report to the police for me? And you can do it. In fact, recently we had a woman who didn't have much. She reported a case of an abuse in relation to a child, and she took the child to the hospital. She couldn't afford the medication and all that, but she did an excellent job by taking the child. She didn't think about, oh, I don't have any food to eat, or I am poor, I am this. No, she sent the child. So within our system, I mean, when people call out for help, most of the time they get that help. So it is not like, it's unlike in Europe where the system, the social system is it's different, not a bit, but quite different from us.
Well, their social welfare system is way advanced than ours.
I'm not even talking about the social welfare system. I'm talking about the normal social interactions, you know, because in Europe, and as I was telling you off air, that I had a neighbor in the UK, and I honestly didn't know her name. She sent me a card during Christmas, and I wanted to send the card back, and I honestly didn't know the name, you know. So it's different. If it had been in Ghana, of course, you would have known the person's name and all that. So the system there is different, and it is here. So we cannot say that because it was restrictions, because if the person is abusive and monitors, it will monitor you even in normal times. You know, so it's difficult for us to use that argument to make a very strong, you know.
So can I ask in this way, how do people come forward? Do they walk to the police station themselves?
Yes, some walk to the police station. Afterwards, I'll talk about the hotline during the period. So people walk to the police station. People also call. We also have informing us about abuse going on and all that. So it's the normal way people report cases for all other cases. But most of the time people walk in. Most of the time people walk in. And during the restriction time too, with support from UNFPA, we were able to reactivate the DOFSU hotline. And we had, I think within a month or so, we had about 6,000 calls coming in.
6,000.
Exactly. And you see, that is also another area, because when you look at the 6,000 calls coming in fact, the cases that were strictly domestic violence cases were about 200. Okay. The rest were asking for food. You know, so at a point in time, in fact, I was asking myself, did we really activate the hotline at the appropriate time, you know, technically, because most of them were calling for food, because there were other numbers where you could call and get food. So people, when our numbers went out, people were calling to say, we need food, we need that. So we had about 6,000 calls. But when you look at the statistics, direct cases were about 200
Okay.
cases.
And these 200 people, were they the people being abused, or they were reporting other people being abused?
Oh, some were personal, and these were not cases that were happening during the lockdown period. Okay. They were cases that had happened before.
They just found it convenient because they now have a certain hotline to tell you about their issues.
Exactly. So some will call. In fact, there were cases that we received, and when we followed up, then they tell us that, oh, we've resolved it, so you know it's not necessary, it's okay now, we are okay. So there were cases coming in, but not related. So when you make reference to what happens in Europe, especially when it has to do with their hotline, you realize that it's one of the areas that they use to assess whether the cases of domestic violence had increased or not. Now, in our case, if you take the same hotline, I mean the same format of reporting, and analyze, you realize that cases were coming in. So if people were being abused and they had phones and they were not being monitored like Auntie Dinah said, then they could call. But of course, when you are at home with an abuser, he can decide not to allow you to make calls. It is very possible. But you see, the good thing is also that in Ghana is that the way our community setup is, most people live in compound houses where they share common bathrooms, where they share common toilets. So there is an avenue to report if you want to. And so, for instance, if I'm being abused at home and I share a common bathroom with neighbors, I mean, going to bath, I could, unless maybe my husband also follows me. But whichever way, you have some opening that you can make reports. And so for looking at the statistics, genuinely, we did not have an increase in domestic violence during that period. Okay. In fact, the interaction that we had with other women and other men were that for women, they were happy that their husbands were home. So some of them decided to take that opportunity to make their husbands see them as loving and caring, as a technique, as a way of trying to draw the men to them, because maybe they were not having, full access to them in terms of their time and all that. So some were happy. So instead of picking maybe quarrels in one way or the other, they rather wanted to use the occasion to draw the men closer to them.
So this was more of a bonding period.
Exactly.
Okay. Exactly. Well, Dinah, could it be that the things that, because when she was talking about the 6,000 calls and only 200 related to their job, which is domestic violence, I was thinking, well, maybe the things that worry us the most, if there is poverty, if I am hungry, I won't think about abuse, would I?
Yeah, I mean, I would want to secure food for my children first, before probably reporting a slap or an insult or a restriction that I encountered from the hands of my partner the night before. So you are right. What does that also say? We had a hotline for domestic violence cases, and we received 5,800 people asking for food, and only 200 of these cases being related to domestic violence. Could it also mean that the release of the number came at a time there were so many other numbers going out for rescue, for support, for food? Could it be then that people did not quite get it, that there was an avenue to report domestic violence? So they thought all the information going out was related to how you could get support to handle the crisis? And I think one of the ways we can increase or enhance the usefulness of these hotlines would be to repeatedly advertise it. I still see in other parts, for example, in the US, where they still advertise call 911 for this and call 911. And I wonder, why do we continue to advertise 911 today? Because 911 is so popular that to those of us, even in Africa and in Ghana, in our villages, also know about 911. But then they continue to repeat it on TV all the time and say, call 911 in case of this and call 911 and make domestic violence adverts, talk about intimate partner violence, and encourage people to report, to seek help. You'll notice that during the COVID crisis, there's been a lot more adverts about the crisis, education about the crisis, how to prevent it, and all of that. And very little about the other things that could be happening. And we can all say that first things first. We were plagued with an unexpected situation. We had to rise to the occasion, increase information, and ensure that people are prepared. One of the things that probably we're beaten to was to miss the opportunity to weave that in with the other issues that could emerge, which included domestic violence and sexual violence. Sexual violence, no doubt, just from the media, Mama V, take a scan and you see how high it's gone from little babies to grown-up women who are being sexually abused. So the fact that 5,800 cases were looking for food probably tells us the way this was advertised probably we didn't distinguish it from what the other numbers were supposed to serve, and therefore people did not probably get it, that if you actually were being abused, this was the number to call.
Okay.
So that could be one of the ways. But it is my desire that domestic violence as a practice is eliminated completely from our society.
Absolutely.
So if that is what Madam is seeing, we are hopeful that that is what actually is on the ground. Mama, I want to chip this in. Madam Osua actually points out that domestic violence is not ordinarily is not properly reported. Very few cases are reported. And I agree with her. If you look at the statistics per annum or yearly from DOFSU, and you compare it with research, you know, there's one thing about reported cases, and then there are other statistics we work with. So in Ghana, we said domestic violence prevails between 33 to 37% of women have been abused or will be abused in their lifetime. And these information were generated from research that were done either by the Demographic Health Survey, by the UNICEF research, or by isolated research, national research that the country undertook, that established that kind of prevalence rate. When you compare the national prevalence rate to the reported cases rate, you would agree absolutely that domestic violence cases are underreported. And we think that even in this era, it will be more so if we do not put in deliberate efforts and awareness creation and encouraging people to go to report. And note that when abuse happens, Mama, I want to throw this, so you ask Madam how it's going. People are usually, when it's physical assault or sexual abuse, they're given medical forms to go to the police and report. It's not only you showing up at the hospital to get to go to the hospital and get a report. It is not only you showing up at the hospital where people don't already want to go. It is also about you paying a fee for the medical doctor in a public health institution to sign that form. You are already dealing with feeding all your children who are back home from wherever they were, your entire family who are back home with you. And then now you have to find between 300 to 800 Ghana cedis to pay for your medical forms to be signed before the police can probably process this case for court or for whatever actions they need to take. That is a disincentive, and even more so in a time like this when our priorities probably have changed. So it's very important that all these things are put into perspective before we conclude that we are safe and things are fine. Okay. I would rather be interested in saying, how do we dig beneath the surface and be sure that our citizens are safe, be sure that particularly women are free from violence, and be sure that our children are protected. Mama, if we talk about the crisis time, we said the lockdown is over. Not, for example, many people are not traveling anymore. A lot of travels have been cut. Partners who used to work out of town, who used to travel out of the country frequently and were giving breathing spaces for their partners who were being victims of abuse to maneuver, are no more traveling. So in as much as we are not under lockdown, we are still not in normal times, and the manifestation of our normal time transcends through our families and in our relationships. So attention needs to be paid on how we give information, how we educate our women, children, and citizens, and how we ensure they are protected.
Okay, well, fortunately, our director of DOSU is also a legal practitioner, so she'll put that in perspective for us.
Yes, yes.
Can we get you want to?
Yes, I want to respond. Yes, react to some of the things she said. You know, let me give credit to UNFPA. UNFPA did a lot of work with DOSU and other stakeholders during the COVID, you know, just when the COVID, you know, we started recording cases of COVID and into the lockdown and after. There were a lot of public sensitization, drawing the public attention to the fact that there is a possibility that SGBV could increase, just as it's been, you know, it's increasing in Europe and other places. So a lot of work has been done and continues to be done by UNFPA. And then also, one other thing that I also noticed is that it is not about the number, people didn't know that the number was hotline. I had messages, WhatsApp messages from the same hotline number where people were asking me, they knew it was not a place for food, but they were personally asking me money. That, oh, boss woman, because normally when I come on air like this, I put the number out, and then they say, oh, boss lady, please, can you send us some money? Oh, this. So you could see that the message that I was receiving on the WhatsApp were messages that showed that they knew that it was not a place for food.
They just wanted to take advantage.
They just wanted to say. So it's not about for the information not being well carried out. No, it's about, as she said along the line, people were hungry at the time because some of them had to stay home and not work. And so they were looking for food. So it didn't matter whether I had to call the hospital and I'll get food, I'll do it anyway because, you know, Ghanaians like to give out. So even if it's a doctor and I'll call and the person is touched, the person can decide to give me the money. So it's not really about not knowing what the number was about or not. And then she talked about the medical form.
Yes.
Yes.
That has also generated a lot of commentary in the last few days.
Exactly. I mean, it is one of the hindrances to having...
There's a fund, isn't there? We established the fund.
Honestly, I don't want to talk about the fund.
Because the fund is also under a different setup.
Exactly.
Yes.
So I don't want to go there.
Okay.
I'm not the PR or the spokesperson for the board. But what is happening is that, yes, we need the medical form to go to court. It's an expert opinion, you know. And even though in law we say expert opinions are not binding on the court, but they are persuasive. And also, we also can look at it from the point of view that it also corroborates the story of the victim. So in law, when you look at the evidence decree, it says that corroboration is not necessary under section 7. I think 7.3, that corroboration is not necessary, you know. So unless it has been prescribed by law, like enacted by a statute says that in this particular case, you must have a corroboration to, you know, the evidence. Now, in this situation, what it then means is that you can decide to go to court, and in a case, the judge can decide to give verdict either in your favor or against you.
In the absence of a medical report?
It is possible.
Okay.
It is possible. In fact, somebody can be convicted or acquitted even on the basis of just one witness in law. But you see, the good thing with having more evidence is that it strengthens your case. So it doesn't mean that because maybe in law, unless it is stated categorically that in this situation you must have corroborative evidence to support it, it doesn't mean that when you have it, you can't go to court with it. It helps, it's easier. Because when you don't build a strong case, it is easier for a defense lawyer to step in and create some doubts in your defense, and then you might lose the case. So medical form for us, police is very important for us. But the problem has to do with the payments of the fees.
Okay.
Now, yes, so when you look at the Domestic Violence Act, it states categorically that when a police personnel accompanies a victim to the police station, to the hospital, the victim is entitled to free medical care. It's in the Act. Okay. And then secondly, whatever crime that is committed not against the individual in law. It's committed against the state. And that's why we say the Republic versus, unlike civil cases. Now, in this state, what it means, therefore, is that it's the state that's supposed to foot the bill. Now, when doctors are subpoenaed to go to the court to give evidence, what they are supposed to do is that when they go to court, whether their cases were called or not, they should send the form, the subpoena form, to the registrar. The registrar of the court will then endorse the back that he came to work to court until the time when he's no more needed. I mean, he's finished giving his evidence. And then he will tender in, hand over the subpoena to the registrar, who they will go through the process, their internal processes, and then the court will pay you the money. And they normally use is a kilometer distance to calculate. Okay. So, for instance, if you are in Bolga and maybe you examine a patient and you need to come down to Accra and to give evidence, the court is going to use that distance traveling from Bolga to refund. So it's not like it's a flat rate. Okay. And that is what they are supposed to do. Taking money from the victim is a no. It is not founded on any law.
So the usual practice, what we see now, where they're charging between 300 and 800 Ghana cedis, is something that shouldn't happen.
No, it shouldn't happen.
In the absence of
let me give you an example. Let's flip the narrative and say if it were to be police, and then you came to the police station and I say, you know what, I don't have a vehicle now, so I need to go to the crime scene. So give me money or pay my transportation. Mama V, when you hear the story, how does it sound? It's the same thing I'm doing now.
But we hear it.
Exactly.
It is done.
Exactly. So if you hear such stories, how different is it from what the doctors are doing now? How different is it? So if the policeman, you hear the policeman doing it, and you think it is wrong, because, I mean, seriously, it is not for the policeman, even though we do it. Recently, I think Labadi commander personally spent 700 Ghana cedis on a victim who came down from Kumasi to identify a suspect for the police officer to arrest and send the person to Kumasi. When she came, where to sleep, what to eat, she had nothing on her. It was that commander that spent money on that person from his own pocket. You understand? So assuming spending 700 Ghana cedis on an individual, then a second person comes in, and then the second person also needs help. So if for the doctors, it's a genuine concern that they have, and that's why, because they have to go to the court to give evidence, their fuel and all that. Then let's look at the narrative. Is it allowed for us to do that for police? No. So if it's a no for police, how come we are so quiet? Not quite like quiet, but looking at it from a different angle.
It looks like, well, that's because maybe we didn't have this basic understanding that, the picture that you've painted. So what it is really is that the hospital is supposed to deal with the courts?
The individual doctor. So when you are subpoenaed, of course, you have to inform your administration that I have been subpoenaed to give evidence in a case.
Okay, isn't that different from I have a medical form from the police and I'm taking it to a hospital for a doctor to examine me?
That's what I'm saying, that the money, according to the argument of the doctors, unless I didn't get it right, but the argument of the doctors, their argument has been that when I am called to the court, the money they take because when they are called to give evidence, they have to transport themselves there. So it is for transportation to go to court and give evidence. And I am saying that if it's for transportation, the state has made provisions for that. And so what you do is that all that you do is that, and it's not only limited to doctors. you know, any other person who is subpoenaed to give evidence. I know policemen who were subpoenaed, they came all the way from Kumasi not quite long ago, and then they went through the same process, and their checks were issued. You know, so if it is about transportation, it is not for the victim to bear the cost. It is for the state to bear the cost. And you see, it's like looking at two individuals. One is strong and a weaker one. So it's easier to take from a weaker one because the victim is a weaker person in this situation, and the state is a stronger, you know.
I'll go for Dinah for a reaction, but I just wanted to ask, how is this hindering people from coming forward? Do they always return with the medical forms?
No, they don't. In fact, sometimes, and you see, it creates an avenue for the suspects to also step in and take advantage. So sometimes they go back to the hospital. You know, sometimes these people, normally our abusers are people who are known. And because they are people who are known, what then will happen is that they will go back to the environment and say that, oh, you see, I couldn't even afford my medical bill. And then the person will say, oh, I can pay for you. So then the suspect steps in to pay, or the family steps in to pay for the medical bill. And as a result of that, you realize that it creates an opportunity for them to settle the case. And then, so it hinders our, it's one of the ways that the absence or the inability of victims to access medical forms, like get their medical forms signed, it's one of the ways that it hinders our investigations.
Okay.
So,
all right. Well, we're getting to the close of the conversation. Dinah, I'll give you the opportunity to react. And then the last thing we'll do, because we want the numbers to stick on people's minds, will be to give the numbers out. Maybe we can have just some few minutes so you can call us. 030221169102. We'll also take you to Kumasi. We're getting reports. Candidates at Cheneboa Kodua Senior High School at Kumewu in the Ashanti region yesterday resisted what they term strict supervision of the ongoing exam. Sounds funny, but that's something that's happening on the ground. So we'll get in touch and give you details. But Dinah, let's get your reactions.
Yes. For any practitioner like Madam Kyeremeh and myself, the whole medical form thing is extremely frustrating. And we have also been made to understand that this is a legitimate entitlement of the medical officers who sign these forms. And when it comes to, I think Madam described what I think ought to be, but it is a sharp departure from what actually is. We understand that the doctors are entitled to this form or these fees because that is how they are supposed to cover their costs for going to court. No. But often than not, the demand is made upon the victim before that medical report or form is.
Okay, looks like there's a freeze in the connection. So let me take comments from Robert. Robert is in Kaneshi. Good morning, Robert.
Yeah, good morning, Mama V. How are you?
Very well, thank you. Thanks for joining us. Let's hear you.
Yeah, two things. One, I want to ask, male and female, per the records they have, who are the most abused? That's one. And then number two, when it comes to sexual abuse, have they ever received a case where a wife reports the husband of sexual abuse, or the husband reports the wife of sexual abuse before? I want to know.
Okay. All right, Robert, thank you for joining us. Madam?
Yes. The number of, between men and women who report more cases, women, obviously. I mean, the number of reported cases over the years since, for instance, DOFSU was established, has always been a woman. And the number is more than 80%. More than 80% of women are the abused, you know. And those who, men who report are around 18%. So it's still very high for women.
Okay. Dinah, maybe we have a stronger connection to you now.
Okay. Oh, I didn't notice that I had disconnected actually. So what I was saying, the worst of virtual interviews. What I was saying is that the practice as it is now is that when you go to the hospital, you are treated. The doctors have never declined to treat victims of domestic violence or sexual abuse. What the hassle has been is that when you need them to sign, so it's one thing being treated of the abuse, and it's another thing giving a report to the police to say that, to attest to the fact that you found this, you discovered this, and this is what you see, which then backs the report that you gave to make a stronger case in court. But when it comes to signing that form, that is where the practice has been, and having worked directly with victims for 5 years and sometimes taking them to the hospital myself, the practice has been that if that money didn't touch the table, that form, which is a special form that the police give to you, will not be signed. The patient could be treated, given medications, detained at the hospital, everything, but the doctor will not sign that form until that money is paid. That has been the practice. And we have never had the courage to tell them, sign the form, and when you go to court, you apply for your reimbursement and you get your check. It has never come up before, like the way Madam is explaining it. So obviously, a lot of people have gone home and not come back because of the form. And that is where we have had resettlement of defilement cases, domestic violence cases, and that is where we have built a disinterest or lack of interest in going to the police and pursuing the case to seek justice. And that is where we have empowered the abusers to continue to abuse because they know nothing would happen to them anyways. So this is our predicament. And I think together with the police and together with other stakeholders, we need to address this issue head on.
Okay.
The domestic violence...
On that note, Dinah, sorry, let me talk to Raymond. Raymond has been holding. Okay. He's joining us from Sunyani. Good morning, Raymond.
Okay.
Hello, Raymond. Unfortunately, we lost you. I can understand. You've been holding on for quite a bit. Can you give us a call?
Madam Kyeremeh, the earlier caller asked whether women report sexual abuse from their husbands.
We don't have those cases coming in normally. I know of one case that went to the courts and the husband was jailed. She had surgery, and after recovering, in the process of recovery, she decided to go to the farm, and the husband followed her up and had sex, raped her on the farm in the presence of their younger child. And that case went to court, and the husband was jailed. So people should not assume that you cannot be held for sexual abuse in a relationship, within marriage. No. Yeah. Once the sexual activity is abusive, you can be held responsible.
So practically when the husband is jailed, what happens to the rest of the family? But let me talk to Christian.
Mama V.
Let me talk to Christian and Joy. I'll come for a reaction on that, and then we have to close. Christian? Hello, Christian? Okay, we don't have Christian. Do we have Joy from Labadi?
Hello, Mama V. Good morning.
Good morning, Joy. You sound joyous this morning. Thanks for calling.
Yes, thank you too. How are you? I always admire you. Keep the good work, okay?
All right, thank you, Joy. But to the issue that we're discussing, any comments or questions?
Yes, I have an issue.
Okay.
Do you know about this domestic violence thing? When the police gave you the police report to go to hospital, and you are able to penetrate, and you send the police report to the police, how to go about the case? The people will be giving them the money, even the one who committed the offense. They will go, I'm a victim. I'm a victim. So if you can please help me so that we can take up the case.
Okay. All right, Joy, here's what we'll do. Just give your number to my producer, okay?
Okay.
Then we can connect you to Dovsu so you can deal with this matter. Okay, all right. Michael is in Keta. Good morning, Michael.
Good morning.
Yes, Michael. We can hear you. Please go ahead.
Yes, I'm very glad that you have had a program like this on air. It's an eye-opener. And there are so many things happening within the country that is that is bad, and and you see, it keeps bringing our country down each and every day. How will a victim who has been abused go to hospital and a doctor will ask him or her to pay for medical form? It's quite unheard of. And you see, that has made, you see, the society, you see, justice for the poor is no longer available. Justice for the poor is no longer available. So the rich or the victim who is poor can never have justice in this country. And we say, and we keep propagating equality before the law. There's no equality before the law.
Well, we see the point you're making. Thank you very much for sharing. Chenebua is in Dadiese in the Western region. Chenebua, good morning. You're on air.
Yeah.
Good morning, sir.
Good morning.
Yes, sir. We can hear you loud and clear. Go ahead, please.
Mama V, good morning and thank you for the wonderful job you and Madam Kyeremeh are doing. Yeah. Hello.
Yes, sir. You're on air. We can hear you. Please go ahead.
The issue of the medical reports is creating a lot of problems for people to pursue their cases. There are so many instances. You go to the hospital and they say, bring 300 Ghana cedis, 200 Ghana cedis before they sign your police report for you. And to your utter surprise, the victim may not have a PESWA. And this because of the medical report, the person will go home and will never pursue the case. So really, this thing disturbs personally myself, because I don't know why when somebody is abused, somebody is assaulted, and he has to go to the police, he has to pay this 300 before the case is, taken up. So, Madam should address that case very well for us.
Okay, all right.
Thank you very much.
Thank you very much. And that's where we have to end the phone calls. Let me come to you because this medical bills thing has become rather very topical right now on the show. So, so what's the way forward?
Well, what we need to do is to engage the medical doctors, whether through GMA or the appropriate quarters, and bring it to their attention. Maybe find other means of ensuring that they have transportation to the court, and also to bring it to their attention that there's a provision has been made for their transportation, which is when they get to court, the registrar signs or endorses their subpoena forms for them, and at the end of the day, they hand it over to the registrar, and then the registrar goes through the process, and then their monies or their transportation is then paid. Maybe they are not aware that this provision has been made for them in law, technically speaking. And so we would have to engage them more, and get other stakeholders like the media and other interest groups on board for us to resolve this issue of medical, because it cannot go on like this. It hinders our investigation process.
Right.
And also, if you wouldn't mind, I would like to put out the hotline.
Let me take Dinah's last comment, because I think she didn't quite finish the statement that she was making. But I see that Ransford, are you on the line?
Yeah, I'm on the line.
Okay, all right. Please go ahead.
Yeah, so I'm calling from the Dublin, and then I want to ask your guest that giving the medical doctor, the sole right to sign this medical form, actually promoting some form of corruption in the health sector, where if the doctor has an interest in the case, whether the findings negative or positive, they are going to comment the way in which another one has to assign or empower other health workers. For example, if the victim reports with a rape case, I think the senior midwife on that particular one that did the examination with the doctor this particular form so that it makes it more authentic.
Okay.
If it's an ASCOP, I think there is a head nurse, whoever did the procedure or did the investigation with the doctor, could also attest his signature. So that it wouldn't just be the doctor. I've seen instances where a doctor alone in his office and then writes even without the investigation being done. So I think we should look at the law that makes empower the doctors to do this kind of investigation.
Okay. All right. Okay, Ransford, thank you very much. I see you say you want to clarify something. He's talking about possible conflict of interest.
With doctors?
With doctors.
I didn't really hear him very well.
Okay, so the suggestion he's making is so if it's a rape case, for the senior midwife, the person who does the examination, to also sign alongside the chief medical officer, for instance, to authenticate what is on the paper. But I don't know how it works. Is it the medical officer who does the examination who fills the form?
Yes.
Or is the chief medical director who is not necessarily
the one
checking
who
examined? The victim?
Oh, yes. No. Normally, the medical forms that we've had so far have always been endorsed by the medical doctor who
the one who does the examination.
Exactly, who does the examination.
Okay, well, he has another concern there. Maybe you can look into that a bit later. But Dinah, just apologies just because of time, if you can make it very snappy for us.
Okay, then I would pick this. You asked a very interesting question that people always ask. If a man rapes his wife or violates his children or beats his family and we jail him, what happens to the children? The same thing that happens to a man who embezzles state funds, the same thing that happens to a man who beats his colleague in the office who has been jailed. And you see, when we are jailing such people, we do not ask what happens to their wife and children they leave behind, who probably they so loved and cared about. But when we are taking people out of their homes, people who abuse their family, we ask what happens to the welfare of the children. If as a state we are able to jail anybody who commits a crime, so long as it's a jailable offense, why would we be concerned and worried about jailing someone who rapes his children, who rapes his wife, who beats her, and ask what happens to the children? But that question comes out often because we don't have a very strong welfare state system that provides for the family, and then it weakens all our efforts. If you take the Labadi commander who is giving 700,000 to every victim who comes to support the process, what happens to himself and his family? That is where the system is weakened at, and that is the broken link, which makes it difficult for justice to thrive. And I think our welfare, our response system as a country for domestic violence cases, our shelter systems, our domestic violence fund effectiveness and all of that has to come into the conversation. Okay. And I support Madam that we need to pick up the medical fee issue from a very comprehensive way and ensure that we engage the policy that gives legitimacy to the receipt of this money by doctors, and probably review that law and look at how the NHIS, for example, will be able to take up that cost, because indeed it is a real cost. Okay. If at the court level, the doctors are not confident that it will work effectively to their interest, how about the NHIS, so that is billed to the NHIS? Okay. I think we have to pick this up more effectively.
Fantastic suggestion. Yes.
Just to clarify, so there is no legal basis for the monies that the doctors are taking from the victims. On the medical form, it's written, I think, in pesos, and that was meant for private hospitals. You know, not government hospital, because government hospital is the state. Of course, you can't go to private hospital and say, you know what, because the state doesn't take care of the private hospital. So you can't say they should just endorse and take care of you without paying anything. So people over the years, some doctors over the years have interpreted it to mean that because it's on that form, it means that they're supposed to charge the fees. Okay. And let me also say that it's not all doctors who, of course, the majority do take monies, but we have some doctors who do not take money. Okay. Yes, so we need to acknowledge. Yes.
Okay.
Yes.
All right. I wanted the last thing we do the numbers. Yes. Just before we wrap up. Yes.
So for our hotline, the DOSU hotline is 0551 000 900. Hey. 0551 000 900. I'll go over it again. 0551 000 900. With support from UNFPA, we are just 900. Okay. Yes. So with support from UNFPA, we're trying to get a short code. That will be easier yes. So it's in the pipeline. In the near future, we'll have something shorter, but this will still be available. And we are on WhatsApp as well.
Okay, so this number is also on WhatsApp.
Yes, it's on WhatsApp.
Well, before we close, we'll put the number. Okay. Oh, Toma has already put that on your screen. So please capture it. You can take your phone and take a shot of it, and you can WhatsApp as well. Please don't call to ask for food. Call when there's a domestic related issue.
And even if you have complaints, generally, if you've sent a case to another police station and maybe they are not working on it the way you want, just report. And you know, people always have the perception, even before they go to report the case, they have the perception that the police has already taken bribe. So they go there, they don't understand systems, and then they end up, and there are some also who play mischief. In fact, a lot of them that do. That's why sometimes, not sometimes, we encourage the media to always check their story with the police before they go out. Because most of the time they are up to mischief, and it's so easy to use the media against the police in such situation. So I would want to use your platform to plead with your other journalists, other media houses. Peace FM is doing a very good work. Nanaya Kunedu, I think. I mean, sorry if I'm not supposed to use your platform.
No, go ahead.
Okay, so Nanaya Kunedu, they've been doing a very good job. Anytime they have such complaints, they always cross-check with DOFSU. And then they realize that, oh no, the story is not as it is, you know. So please, instead of just the complainant or the victim walking to the media house and say, oh, I went to a police station and they took bribe and blah, 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 and they gave cake, please, check from them. Yes, because most of the time, they want the police to do certain things for them, which is not right. And the police is resisting. So they want to use the media against that. So it is not always that the police is doing something wrong or something fishy.
You. Thank you very much. Thanks for spending this time with us. Dinah, really grateful, always very grateful, because you help us. You come from a certain perspective which is very unique. It brings a lot of understanding to what we discuss. So we're always grateful. Thank you for your time as well. Chief Superintendent.
Thank you for prioritizing these issues for us as well.
All right. Chief Superintendent Owusu Kyeremeh is Director of DOFSU. That's the Domestic Violence and Victim Support Unit. And of course, our own dear Dinah Diko is a gender activist. She used to be technical advisor at the Ministry of Gender, Children, and Social Protection. Thank you for all your calls. Now, let's go to Kumasi. Nanaya Jima is standing by. A group of students resisting strict supervision. What is strict supervision? Nanaya Jima will give us the details. Nanaya, tell us about the story.
So we are talking about the Chinebu Akodia Senior High School in the Kumawu, Kumawu district, Kumawu to be precise. And students yesterday went berserk after writing the first part of the integrated science paper, which came off yesterday. And according to students, the invigilators, particularly the head teacher, had been too strict on them when they were writing the first part of the paper. So some of the students with claps marched to the district chief executive to report the headmaster to him. According to them, if the district chief executive refused to take off or take out the head teacher, they will not sit for the second paper. So the district chief executive had to intervene and come to the school to calm tempers. But before then, some of the students who remained on campus were supposed to go for dining, but when they got to the dining hall, they were so angry that they toppled over the food that was served and other furniture in the dining hall. So presently, the